Our most important asset, I guess you would say, is our therapist and the human interaction and touch. So, it's kind of like with anything with technology, you can make it brighter and shinier and fancier, but are you really getting anything for that? And in some ways, that might take you away from the human element. So we really, like I said, our therapists are our biggest asset, and they do a great job. You could probably put them on a deserted island, and they could figure out how to do excellent therapy with you. I would say probably 95% of our patients come from the acute side of the hospital, either within St. Joseph's Candler or external hospitals. And so folks who come to us, they have been sick, they've frequently had many multiple medical complications, so they have lots of physicians who are seeing them. So when we're still in the hospital, those physicians and subspecialists can continue to see the patients and have that continuity of care, whether it's their cardiologists, pulmonologists, nephrologists, they can all continue to see the patients daily. The other really important thing is getting quick imaging and lab testing turnaround. We can get blood products quickly. So really we have the resources of the larger hospital that a freestanding facility would not have. We're also able to do, especially with speech therapy, able to do modified barium swallows on site instead of having to transfer out for something. So we have a lot more kind of acute care resources that we can then use even for folks who are on the rehab unit. So we have CARF certification, which is a rehab-specific certification, and so similar to magnet certification or JCO, it's just looking at rehab-specific and looking a lot at outcomes and plans, and just overall just holds us to a higher standard and helps us hold ourselves to a higher standard so that we know that we're doing the best job from a compare us to a national organization and really keep our standards high. We're the only locally CARF certified rehab units in the region because it does take a lot of work to keep up those standards, and we have site visits, and so they come and look. It's not just submit a piece of paper. They come and look at us and look at our rooms, talk to our patients, and so it's a strenuous requirements, and so we're very proud of it that we're able to hold that high standard. So every patient that comes into rehab is obviously very different. There are some higher level, big city rehabs that are just stroke or just ortho or just spine. So they have more of a, I don't want to say cookie cutter, but more of a regimented approach. All of our patients are very different. So a lot of what we do is talking to them about what their needs are at home, what their home setup looks like, what their caregiver support system looks like. So the therapists and nursing staff and myself kind of run with that. So, we have people who are fully independent at home. They need to practice grocery shopping. They need to practice cooking in our kitchen. They need to do, very high level things. Other patients have a lot of caregiver support at home, so we have to focus on family training and things like that. So, the therapist kind of having that global view of what does your discharge home look like, and what does your life look like that you want to get back to? So we do try to look at the whole patient again, focusing on what's important to them and helping them through this. A lot of our patients were very healthy before, and they've had a major life change to then end up on our unit, and processing that is difficult. So looking at the whole patient, spiritually and emotionally, helps their success physically. It doesn't benefit anybody if you get somebody walking again if they're too depressed and sad to leave their house when they get home. So really focusing on how they can work through that and see their recovery.